Hi and Assalamualaikum. My name is Aina Fariza binti Muhammad Amran. My matric number is 422300381. I will overview the background of the case in biological hazard about spread of COVID-19. In Malaysia, the COVID-19 pandemic involved a multi-phase approach by the government. In early 2020, as the virus began to spread globally, Malaysia implemented strict measures to curb the transmission. These include national worldwide lockdown, travel restriction, and the establishment of quarantine protocol. This effort aimed to mitigate the biological hazard presented by the highly contagious nature of the virus. Workplace had to implement the rigorous hygiene protocol to protect the employee, ranging from the regular sanitization of facility to enforce of social distancing measure. The collaboration helped the health authority and business to develop and implement the effect strategy tolerate to different sector. Basically, public awareness play a crucial role in navigating the biological hazard associated with COVID-19. Government and health agency engage in extensive communication campaign to educate the public about the virus and preventive measure and to the improvement of vaccination. This emphasize on community engage aim to empower individual to take an active role in minimize the spread of the biological hazard. So, Malaysia case is exemplify the intricate interplay between government policy, industrial adaptation, and public awareness in managing the biological hazard posed by the COVID-19. That's all from me. Thank you.
Hi, Assalamualaikum and good morning. My name is Muhammad Ismail Haris bin Idan and my metric card is 422300361. And next, I will discuss about the three reasons or possible cause which contribute the biological hazard of COVID-19. Firstly, insufficient in personal protective equipment. The insufficiency of personal protective equipment was a crucial element that left the healthcare personnel vulnerable to biological danger throughout the epidemic. Multiple factors contribute to this scarcity, global disruption in supply chains. The abrupt increase in demand for personal protective equipment on a global scale caused a disruption in the worldwide supply chain. As a result, there was scarcity of crucial products such as N95 receptor surgery mask, ground and face shield, which left healthcare professionals without adequate protection. Second point is inefficient provision of extensive training and education. Comprehensive training and education regarding infection controlling technique are necessary to ensure the safety of healthcare workers. Nevertheless, throughout the epidemic, numerous obstacles arose in relation to training. For example, dynamic guideline. The compression of COVID-19 and its transmission underwent significant development. Healthcare professionals have to adjust to rapidly evolving standard, and suggestion result in possible confusion and gaps in expertise. Second, limitation in available resources. Resources limit, scheduling challenge, and the immediate need for care have hindered many healthcare facilities from delivering complete training. Certain employers may have lack adequate instruction of essential subjects such as appropriate personal protective equipment, utilization and infection control procedure. And lastly, the third point is challenge in patient care. Healthcare professionals encounter distinct difficulty associated with patient care. They contribute to biological hazards. Proximity to patient providing medical care to individuals with COVID-19 frequently necessitates intimate and extended interaction, hence heightening the likelihood of being exposed to the virus. Healthcare professionals were required to conduct tests, deliver respiratory assistance, and carry out additional procedures in hazardous setting. Insufficient isolation facilities, they were constrained in effectively segregating infected individuals in certain healthcare environments. Healthcare personnel were at risk of exposure to infectious aerosol in common setting, hence increasing the level of danger. Thank you, and I will pass to the next presenter.
Thank you, Haris. Hi and Assalamualaikum everyone. My name is Nur Sabrina Edina and my metric number is 422-300-6702. Now, I would like to discuss what are the possible route of entry by biological hazard. What is that meaning by you all? A route of entry in biological hazard. So, for my opinion, there are two main ways that the disease of COVID-19 can spread widely around the world, as you all know, which is airborne transmission and organ respiration. What are the connection of that both meaning by the spread of COVID-19? Airborne transmission can be seen consistent by sneezing or our breath or when we cough. When I say about that, it's because when we cough suddenly or have breathing problems or having a bad cold for no reason, right? It can show the effects of COVID-19. So, next is about respiration organs. Okay, respiration organs can be identified from sinus or nose, our nose, lung or mouth problems. Why is that? That is because when we are close and interaction with a COVID-19 carrier or being near an infection individual when in an indoor and being touched by an infection person can be shown that is why the COVID-19 has been spread to us. So, that's all from me. Thank you. I will pass to the next presenter, Atika.
Next, we got factors at risk of biological hazard COVID-19. The first one is close interaction with a COVID-19 carrier, particularly if they are exhibiting symptoms like inhaling these respiratory droplets is more likely when one is near an infected person. It's usually within 6 feet or 2 meters, particularly if the infected person is exhibiting symptoms. Next is being near an infectious individual when in an indoor setting with insufficient ventilation. A sufficient amount of air exchange and ventilation can help lower this danger. The last one we got being touched by an infectious person. There is a higher chance of infection if one touches a contaminated surface before contacting their face. For this reason, it's important to practice a proper hand hygiene, which include frequent hand washing and refraining from touching your face.
Thank you, Antika. Now, let's review the last part of route of entry of COVID-19, and that is the risk factors for severe cases for COVID-19. Firstly, thalassemia or sickle cell illness, blood diseases that impair red blood cells' capacity to deliver oxygen include thalassemia and sickle cell diseases. Next, serious cardiac disorders such as heart failure, coronary artery diseases or cardiopathy, and perhaps excessive blood pressure. Severe heart conditions such as cardiopathy, coronary artery disease, or heart failure point to a seriously weakened cardiovascular system. Lastly, persistent lung, liver, or renal problems compromise organ function is indicated by chronic lung disorders. For example, interstitial lung diseases, chronic obstructive pulmonary diseases, liver diseases, and renal kidney issue. For that individual who suffer from brain and nervous system disorders like stroke, as well as those who have dementia or Alzheimer's diseases, are also more vulnerable. That's all for the route of entry COVID-19. I will pass to Atika again for her part. Thank you.
Hi, my name is Nur Atika binti Razali and my metric number is 422-3000-441. My topic is to briefly explain the statistic report of COVID-19 cases in Malaysia and how this virus is deadly. Here we got Appendix A, which is the total cases of COVID-19 in Malaysia until January 2024, and Appendix B, daily new cases of COVID-19 in Malaysia until November 2023, and Appendix C, we got daily new death because of COVID-19 in Malaysia until November 2023. According to Appendix A, the total COVID-19 cases in Malaysia until 12 January 2024 is 5,244,578 cases. Despite most citizens in Malaysia had already taken their COVID-19 vaccination, the virus is still merely spreading till now. Next, according to Appendix B, showing daily new cases of COVID-19 in Malaysia, based on the statistics, they show the highest the daily cases are on April 2022. However, the number of daily cases gradually decreasing due to Malaysia Movement Control Order (MCO) and vaccinations provided by the government. And lastly, according to Appendix C, indicates the daily death because of COVID-19 in Malaysia. The total of COVID-19 death until 6 January 2024 is 37,306 Malaysian citizens, where the higher death number on 11 September 2021 is 592 Malaysian citizens, and most of them were older people. Studies found that pregnant women, old adults aged 60 years and or older, and those who have chronic diseases are the most likely to get very sick and are at highest risk. That's all from me. I'll pass this to the next presenter. Thank you.
Assalamualaikum, my name is Siti Nashada binti Syahriddin. My matrix number 422300381. Today I will present about control measure that has strong justifications to minimize the impact on health hazard, which is engineering control. Engineering control has paid significant attention for their effectiveness in minimizing the exposure to hazards without relying on workers' compliance. The engineering control also encompasses the control of work environment or processes to achieve reductions in exposure that following the COVID-19 pandemic. This control also took a crucial role not only in densely inhabited states like Malaysia, but also in many countries with vast populations level where there was an impending threat to rapid virus spread. The third one is improvement of ventilation system, which is the one of the basic engineering control has been applied. Ventilation control are intended to reduce the concentrations of airborne contaminant and is the best suit against viral respiratory disease. This also proved to be an effectiveness engineering control measure as such, including plexiglass screen, this production of plastic sneeze guards and other barriers, especially in high contact areas such as reception desks or canteen. The last one is the effective in mitigating the spread of infections disease at workplace. It's required that the point of the specialist engineering measure, which are the adequate put in place, cannot dispense with when ensuring efficient high level and operational productivity for workers during public emergency. So that's all from me. I will pass to next presenter, Sabrina.
Thank you, Shahada. Hello and Assalamualaikum again, everyone. Now for this new part that I will present is about the act that I found that's related with COVID-19, and that is Laws of Malaysia Act 342, Prevention and Control of Infectious Diseases Act 1988. The section that I found that I chosen, the section that has shown is section 1, section 6 and section 11. Section 1 is short title application and commencement. This act may be cited as the Prevention and Control of Infectious Disease Act 1988 and shall apply throughout Malaysia. Next, section 6 declaration of affected area. Wherever notification is received under the international health regulation that an infected area exists outside Malaysia, the minister may be ordered in the Gazeta declare such area to be an uninfected area for the purpose of this act. Last, section 11, declaration of an infected local area. If the minister is satisfied that there is an outbreak of an infection disease in any area in Malaysia, or that any area is threatened with an epidemic of any infection disease, he may, by order in Gazidi, declare such area to be an infected local area. So that's all from me for presenting this part. Now, the last part, not least, is the conclusion of this presentation. To sum up, COVID-19 has revealed the immense impact of biological hazard on global health, economy, and society. It highlighted the necessity of robust healthcare system, effective communication, and rapid response mechanism. The pandemic underscored the importance of international cooperation in mitigating and preventing future outbreaks. Lessons learned emphasize the need for preparedness, resilience, and investment in research, healthcare infrastructure, and public healthcare measures. With that, all parties should work together to eradicate the disease of COVID-19, which is still spreading, so as to be able to maintain the health and well-being of the people. With the end of this presentation from my group, with that the end of this presentation on COVID-19. I apologize for the inconvenience caused by my group members when we doing our presentation. With that, thank you so much for listening to the presentation from my group that are focuses on biological hazard, that is COVID-19. Thank you and Assalamualaikum everyone. Bye.